Good good day everyone. Myself Nilesh Sherke, presenting seminar on an emulsion as a potential of thermal system for dorzolamide hydrochloride under the guidance of Dr. Ujjwala Shinde ma'am. These are the contents for presenting seminar. Introduction. Ocular delivery is one of the most challenging for drug delivery because of the precorneal barriers and anterior and posterior chamber barriers. Um, in precorneal barriers we have eye blinking, lacrimal drainage and tear dilution, etc. While we have in anterior segment barrier we have cornea, then blood aqueous barrier and efflux pumps, and in a posterior segment barrier we have sclera, blood retinal barrier, and vitreous fluid, etc. First we developed the conventional system for topical liquid solution, eye drops, emulsion, suspension, ointments and inserts. But these conventional systems have a problem related to viability and their patient compliance and reducing the systemic absorption. So we approach for a novel system, and these novel systems included nanosystems, which are nanoparticles and nanoemulsions like systems, and also novel approaches like liposome, implant, mucoadhesive formulations. Now we compare the emulsion, microemulsion and nanoemulsion. In compare the particle size, regular emulsion have a 1 to 100 micrometer particle size, but in microemulsion it is from 10 to 100 nanometer, while in a nanoemulsion the particle size is less than 200 nanometer. If we compare with the stability, the regular emulsion is a thermodynamically stable, thermodynamically unstable, but microemulsion is a thermodynamically stable, and the nanoemulsion is a kinetically stable but thermodynamically unstable. And energy required for the preparation of the regular nanoemulsion is a low and high mechanical strength required, while in a microemulsion it is formed spontaneously, and in a nanoemulsion high energy required for preparation. We have advancement of nanoemulsion because when we use nanoemulsion as a drug delivery, then the enhancement of viability are more, and toxic adverse effects are less. This is the snapshot of the article which is published in American Association of Pharmaceutical Scientists journal in 2009. And this is author of this article is Hussein Ammar and Salma Ghorab and Mohammed. Glaucoma is the one of the second most leading disease which cause blindness. And in this glaucoma, when intraocular pressure increases and causes damage to the optic nerve, that results into blindness. Aim and objective of this article is to formulate dorzolamide hydrochloride nanoemulsion capable of sustained release of drug, which results into reducing a frequent installation of dorzolamide chloride, and reduce the toxicity effects. Preparation. Now the preparation and methods. First is the construction of pseudo ternary phase diagram, which is done with the oil system. In oil system, isopalmyrate migliol 812 triacetine surfactant was used 218 chemophoryl, while the co-surfactant are used propylene glycol, triacetine, transcutol and miranol. In the construction of pseudo ternary phase diagram, 36 systems were prepared, and and pseudo ternary phase diagrams were developed using water titration method. After the construction of pseudo ternary phase diagram, percent nanoemulsion existence area were calculated using AutoCAD software. This is the result of pseudo ternary phase diagram in the manner of percent nanoemulsion existence area. we can see here in we can see this diagram which describe about percent nanomulsion existence area in a graphical presentation. And these three graphical presentation have a three different type of oil system. Like first we have a IPM, second have a mixed oil, and third have a triacetin. When we compare these three graphical presentation, when we use triacetin as a oil system, then we get then author get a maximum nanomulsion existence area. And when author used triacetin as a co-surfactant, you can see this white graphical bar, which we can say that when we use co-surfactant triacetin as a co-surfactant, it show maximum nanomulsion existence area in isopropyl myristate oil system, followed by a mixed oil and then triacetin. And then when we compare the type of surfactant which used in a formulation, when we compare twin 80 and chromophore EL. When we compare these two, we can say that when we use twin 80 as surfactant, we get a maximum nanomulsion existence area, as we can see this graphical presentation. And now compare the surfactant and co-surfactant ratio. Where in a IPM and mixed oil, as the concentration of surfactant and co-surfactant ratio increases, the percent nanomulsion existence area also increases. While it is actually reverse in a present of triacetin. When we increasing the surfactant co-surfactant ratio, the percent nanomulsion existence area is decreasing, as we can see here. Next, loading of nanomulsion nanomulsion of dorzolamide hydrochloride. For the loading, we prepared 17 vehicle. As we can see their formulation in a table. In this 17 vehicle, we dissolve 2.22% weight by weight dorzolamide hydrochloride, and vortex it until the clear dispersion forms. This is prepared before investigation of 48 hours, because drug should attain thermodynamical equilibrium in a oil, surfactant and water phases. Now the physiochemical characterization of nanomulsion. Particle size analysis. The particle size analysis is carried out by photon correlation spectrometer. And we can see that the particle diameter is mean particle diameter found was 8.4 to 12.7 nanometer. Now rheological measurement. Rheological measurement were performed at 25 degrees centigrade using Boolean rheometer, and as we can see the results here, the all the nanomulsion have less than 10 millipascal viscosity. Now third physicochemical property is the refractive index. Refractive index was determined at 25 degrees centigrade using refractometer supplied by Higler and Walter, and we see in a result the refractive index is in a in a line of 1.35 and 1.35, and it is the acceptable value, because the lacrimal fluid have a refractive index around 1.36, so it is acceptable value. Now the surface tension. Surface tension is measured by using thermostatically controlled processor tensiometer K100, and as we can see here, the surface tension surface tension of the system is a range of 44.1 to 51.9 millinewton per meter, and it is also acceptable value, because the tear fluid have a surface tension around 40 to 50 millinewton per meter. Now pH was measured at 25 degree centigrade using Geneva model. The pH of therapeutic substance applied in a optical ocular system can vary 3.5 to 8.5, but only when there is no buffer is used. Buffering system is not used. And the pH range of prepared formulation was found to be around 4.2 to 6.7. And osmotic pressure, the osmotic pressure was measured using micro osmometer model 3300. And the range of osmotic pressure found is 500 to 1320 milliosmo per meter per kg. In vitro drug release studies. The in vitro drug release studies are carried by USP dissolution apparatus type 2, which is a paddle. The medium used for the study is 900 ml of phosphate vapor having pH 7.4, and the temperature is maintained at 34 degrees centigrade, and the paddle reversion speed is 50 rpm. As the specific time interval, 5 ml of sample withdrawn and 5 ml of replaced by the fresh vapor, and these samples are assayed by the UV spectrometer at 252.6 nanometer, and all triplicate studies were performed to find out the mean value. And to measure the release efficiency, we use the following this formula, in which the y is equal to percent release of drug in a time t. These are the results of in vitro drug release studies. First three nanoemulsion having containing the oil system is isopropyl myristate and surfactant 280, but have different surfactants. The first which have the highest release efficiency contain the propylene glycol as a co-surfactant, while the second and third respectively have a transketal and triacetin as a co-surfactant. Now is figure 2b. The release efficiency of containing nanoemulsion containing triacetin and 280, but have different co-surfactant. Now compare the nanoemulsion 5, 7 and 9, which have the increasing order release efficiency. Nanoemulsion 5 has a co-surfactant propylene glycol, while nanoemulsion 7 has a transketal, and nanoemulsion 9 have a miranol respectively. Now figure 2c. The release efficiency of nanoemulsion containing triacetin, chlorophyll and different co-surfactants. Now the compare nanoemulsion 10 release efficiency of nanoemulsion 10 with the 11, and then compare nanoemulsion 12 with the 13. When we compare this we found that author found that the 2% the nanoemulsion 10 have a 2% triacetin, while the nanoemulsion have a 4% triacetin in a formulation. So which formulation have a maximum concentration of triacetin have a maximum release efficiency? On figure 2d, nanoemulsion containing triacetin and chromophorial and 280 in 1:1 ratio. The release efficiency of nanoemulsion 40 is less than the 15, 16, 17. From the above release studies, we can study the nanoemulsion 3, 5, 6, 10, 12 and 14 were chosen because of their low release efficiency, and they have possible sustained release of a drug. When we see in this release curve, we can say that all the nanoemulsion we have author selected have a satisfactory release response as compared to the drug solution and market product. Ocular illustration studies. 6 groups of New Zealand albino rabbits weighing 1.5 to 2 kg are selected. Right eye received 50 microliter of the tested formulation, while the left eye was used as a control, and this for continuous 3 days. Results of ocular illustration. Cross section from corneas of rabbit eye after the application showed that the both corneal structure and integrity were unaffected, and the above results results of selected nanoemulsion shows the non-irritant and non-irritant response. Therapeutic efficacy studies. Before we doing therapeutic efficacy studies, formulation are steroid by using 0.22 micrometer pore size pyrogen free cellulose filters. And the reduction in intraocular pressure is measured by a skewered tonometer. The results of therapeutic efficacy studies, as we can see in this figure, the after the installation of all nanoemulsion drugs or drug solution or the market product, the after half an hour the it start to reducing in a intraocular pressure. And when we see carefully, the nanoemulsion 3 and nanoemulsion 6 have a maximum decrease in intraocular pressure. The nanoemulsion 3 is this violet color cross line, and the nanoemulsion 6 is the orange triangles which are used. And as we can also see that the drug solution and a market product have a duration of action until 3 or 4 hours, while the all the nanoemulsion which are used for therapeutic efficacy have a duration of action around 5 to 7 hours. So we can say that all the nanoemulsion in a nanoemulsion have a prolonged therapeutic efficacy as compared to the drug solution and market product. The pharmacodynamics parameters taken into consideration are maximum percentage decrease in intraocular pressure, time for maximum response, area under percentage decrease in intraocular pressure versus time curve, and mean residence time. Let's now see this all the highlighted data. All the highlighted formulation are the most showing most efficacy or prolonged effect in a system. The effect of nanoemulsion components on a drug efficacy. It is observed that nanoemulsion 3 has enhanced drug bioavailability due to the inclusion of triacetin as a co-surfactant. Now compare the nanoemulsion 3 and nanoemulsion 6. When we compare nanoemulsion 5 and nanoemulsion 6, nanoemulsion 6 have 4% triacetin in formulation, while nanoemulsion 5 have 2%. It is shown that the nanoemulsion 6 have a more efficacy and prolonged effect rather than nanoemulsion 5. So we can say that when we high concentration of triacetin in formulation relates into the enhancement of bioavailability and prolonged effect. Now we see the effect of surfactant type. Now compare nanoemulsion 5 and nanoemulsion 10. Nanoemulsion 5 and nanoemulsion 10. Nanoemulsion 5 has a twin 18 and nanoemulsion 10 has a chemophore EL. As we can see here, nanoemulsion 10 have a prolonged effect and maximum decrease in intraocular pressure. So we can say that chemophore EL it results into increased bioavailability and prolonged effect. Now compare the nanoemulsion 12 and 10 for comparing co-surfactant. Nanoemulsion 12 10 nanoemulsion 12 and 10, in which 12 is a transcutal and 10 is a propylene glycol. The nanoemulsion which have propylene glycol as a co-surfactant have a maximum decrease in intraocular pressure and have a maximum bioavailability. And the basis of results of bioavailability study, it can conclude that formulation of dorzolamide hydrochloride as a nanoemulsion led to improvement of therapeutic efficacy. Conclusion. From the above study, author conclude that the formulated nanoemulsion of dorzolamide hydrochloride were characterized by thermodynamical stability studies and acceptable physiochemical properties, and the developed nanoemulsion showed the fast onset of drug action and prolonged effect, as well as enhanced drug bioavailability compared to the market product. And such a formulation offer more effective treatment in glaucoma, decreasing the frequent installation and increasing the patient compliance. These are the references used for this seminar. And
I would like to acknowledge with a sincere gratitude to Ms. Heta Vasani and Ms. Deepa Warrior for helping me patiently on this presentation. And lastly, I would like to thank my guide Dr. Ujjwala Shinde ma'am for having belief in me. Thank you.